All right, for this segment, we're really excited to share something outside of the realm of athletic training. Barbara McCormick came to ATS&J to give a talk from her experience working in emergency departments, as well as various aspects of armed services. She wanted to talk to us about how athletic trainers can be really effective in the emergency department. Barbara is a critical care nurse. She's a part of the emergency department and the clinical faculty with Jefferson Health. She's also a lieutenant colonel for the Delaware National Guard as well too. So Barbara, thank you so much for joining us to talk about your segment, some key takeaways from ATS&J 2023. And the first thing, you gave some really great information about some research that you performed as well as that you looked into. What led to this study that you did pertaining to knowledge deficits, perceptions of athletic trainers, and kind of speak to those key findings that you had?
Having my best friend, an athletic trainer of 30 years, and sharing stories about experiences in the emergency department was what really started this. And when I was looking for a doctoral project at Drexel University, I just one day said, "Man, this is it," because we really need interprofessional care and help in our EDs, especially since COVID and just our staffing crisis. We need help in the emergency department. And interprofessional care is proven to be more effective for the patient. Our patient satisfaction, our safe care, just getting the right healthcare providers at the right time to see the patient is crucial.
Absolutely. And I think one thing you mentioned, 80 in your study, 82% of nurses from the emergency department really had no understanding of what athletic trainers do. 40% didn't even consider them healthcare professionals. Can you speak to that study? Where did you pull that from? I think you said 43 states. Where did you
Yeah,
pull that
so
from? What did you find?
I utilize the Emergency Nurses Association, which I'm a lifetime member of, and I used their platform to send out a Qualtrics survey. And I did that in 2 months, so I really pushed it. I was on a deadline, but yes, I did. But I took a survey that was done by a doctorally prepared athletic trainer who teaches. He meant that for parents' perceptions. So I took that survey, I modified it for emergency department nurses, and then I also taught them what you do in that survey. They really had no idea. So that's where I got that. So I would like to run some more because that was only 2 months worth of data and it was pretty
Mhm.
significant.
Absolutely. And you did speak briefly about this, but just kind of reiterate, in what ways does having an athletic trainer in the emergency department really enhance teamwork and collaboration? You said enhance patient satisfaction. You talked about evidence-based care. What are the gaps there that athletic trainers can really help fill?
So nurses are charged to solve many problems. We end up, because we're the bulk of the workforce, we try to fix everything, but really things get lost. So some of the basic things are orthopedic injuries, especially high school population is who I targeted. When you get sent over, and that's really not a big priority. When you have a heart attack or you have big traumas, the nurse gets pulled away. And unfortunately, like we could really use the expertise, not only with the wound care, the taping, the wrapping, because that's my feedback is not
Mhm.
necessarily done well. We're not educated, the techs do it. Um, but also concussion, head injury is another one. And just listening to the conference, I forgot about mass casualty. I mean, your performance with the Boston Marathon, you saved people, heat injuries. Like that's the kind of thing that you can take by the hand. And not only direct patient care, but our programs to educate. Our mass casualty, the state of New Jersey alone, we have requirements we have to meet that you can really take a lot of that load off nursing. Another topic was, the effectiveness of cardiac care and compressions, and again, NFL highlight, kudos. So we do that every day, but to have your input and to have your focus on that would be just instrumental, I think, because we just run out of time.
Absolutely. It's a great opportunity to work together to leverage our skill set to complement the skill set of those professionals already in the EDs. And we recognize state by state, there's different state practice acts and whatnot. So what athletic trainers can do in each state is different. However, there's opportunities widespread across this country to get involved with that. Let's say an athletic trainer has an interest in pursuing those opportunities in urgent cares, in emergency departments. What are some tips you have for them? Some skills they should work on honing, maybe specialty certifications to look into, just to help give them some action steps toward that.
So honestly, I think just your certification to start, your market, your master's prepared healthcare providers, entry to practice, master's, correct. So not only that, any type of instructorship for advanced for American Heart Association with the hospital stick with for cardiac resuscitation. Um, I think we really have to work together to figure out how we're going to market that. And that's what my goal is. Like I said, I did want it in the ED. I can't offer that job, but I can offer my professional input so we can work together because we know we have obstacles at the state level when we talk our job description. So honing a really good job description. So when I have second degree nursing students who have a master's in athletic training that do a program, accelerated nursing program, because they want a job that pays a reasonable amount of money, that says a lot. And honestly, they probably have a much easier time in education. It's probably, I want to say a piece of cake because I don't think anything is a piece of cake, but
Mhm.
your exam, just like the NCLEX, the athletic training exam, is super hard. And you train really hard and have background clinical. Like we really need to just join forces and come up with a plan. And I'm talking to my leaders to try to get help because I'm spending some more time with numbers and our turnover in our emergency departments. We just can't move on. We have to, for our population and even an outreach with our EMS. That would be a formal way that you reach out with EMS, and even
Mhm.
with the opiates. There's so many things we can do together to just strengthen our healthcare systems within the community, and even and wellness. I was thinking, please help keep us well. I mean, nursing is an extreme. I woke up again yesterday morning after listening to your conference and said, ER nursing is an extreme sport. What a better, proponent, but to have healthcare providers. And it's a team
Mhm.
environment. We need you. I'm trying to get my profession to understand that, but I'm working on it and they're getting there.
Well, we truly appreciate your advocacy, and the last thing I'll leave it with is you made the comment about the idea of not only the athletic trainer being a part of this team, but also being there to take care of the nurses and the staff themselves in the ED, with a recovery room or whatnot, because of the demanding aspects of your job. That's another great way to leverage your skill set. Barbara, thank you so much. Your contact information is in the show notes, and we really appreciate your advocacy for athletic trainers and look forward to seeing more in the future from you coming out about ways athletic trainers and nurses can collaborate to really bridge that gap. So thank you so much.
My pleasure. Thank you so much.
All right. Have a great day.
You too. Bye.
All right. Let me end recording. That was fantastic. That was
Thank
perfect.
you.